Transparency and Accountability in Liberia. It runs from 11 to 12 noon and is relayed on Prime FM in Monrovia. It serves as the primary radio-based communication and information dissemination platform of the Center for Transparency and Accountability in Liberia. It is a key advocacy tool that provides essential information around the state of the fight against corruption, national integrity building efforts, as well as promotes the culture of accountability, transparency, integrity, and evidence-based decision-making across all sectors of Liberia. Under Center's National Integrity Building and Anti-Corruption Program, funded by the government and people of Sweden through the Swedish International Development Cooperation Agency, or SIDA, the radio program serves as an advocacy, coordination, and engagement platform that citizens and other stakeholders support for the fight against corruption and bad governance. As part of this program, Center has established the Advocacy and Legal Advice Center known as ELAC. The ELAC is an independent platform that enables citizens to freely report and seek redress to corruption and other integrity-related issues. There are a team of professionals at ELAC who are willing and ready to receive your complaint and whenever you get to them. So we encourage our citizens, like we have always said, the fight against corruption requires all of us. It requires everyone working together. So we encourage you to report issues about corruption and integrity related from your communities, your places of work, and wherever you find yourself. So there are means through which you can contact the Center ELAC. We have email address. The email address is alec@cental.org.lr. We also have the Facebook address that you can contact us on. It's Center ELAC, or in uppercase. We have hotline number that you can call to report issues about corruption. The number, be it you are using Orange or Lone Star GSM, you can call that number. It's free of charge. So the hotline number, we're going to announce it later. We have walk-in services. If you want to walk in and visit our offices, Center is located just opposite JFK. Just come upstairs and then be able to engage with our team and to provide redress to you. So if you need access to information, you can come and our team will help you in that light. If you need legal advice, you can come. Our team will also help you and provide legal advice, written legal advice free of charge. So all of these services are free. You can come and you obtain those the different services we just mentioned. We are working collaboratively with the LACC. So the Liberia Anti-Corruption Commission, we work along with them. So the LACC has hotline numbers. The Liberia Anti-Corruption Commission has hotline numbers that you can contact to report issues about corruption. So the hotline number for the LACC. Before I announce the number, let me say this again. Before you call, have facts to provide to the investigators. Before you call the LACC or ELAC, have basic facts that you can provide to the investigators. So the LACC hot numbers. The numbers are 0555 39 57 28. 0555 39 57 28. That is 0555 395 728. Or you just dial 48. Those are the numbers you can call to contact the LACC. So discussion on this platform are very civil and informative. So guests appearing on this platform, they are guided by those rules, ensuring that our discussions remain very informative and civil. No use of invective on this platform or denigrating comments. So today is Thursday, September the 3rd, 2021. And this edition of the Integrity Watch radio program is playing host to the Executive Director of Public Health Initiative Liberia, Phil. She is Madam Joyce L. Kilikpo. So Madam Kilikpo, the Public Health Initiative Liberia tackles underlying causes of poor health and inequality in healthcare services, so that people can become proactive and to achieving quality healthcare services despite their status. It recognizes that women and children suffer disproportionately from health inequalities. So it places emphasis on working with women to create permanent social change towards improved health outcomes. So today, Madam Kilikpo accepted our invitation to appear on the platform to talk about health-related issues and accountability in our health sector. So we're going to be joining Madam Kilikpo later on during the course of the program. We'll be joining her in the course of this program. So before we go to her, let us go to little things that matter. Under little things that matter, we want to talk about few issues One is the issue about the allegations about increased secret killings, and insecurity that have been seen across our country. So we are concerned about it. And we wake up most morning and we hear about somebody, body was found this way, body was found in the other place. We are concerned about those kinds of situations. We are also concerned about the presence of huge number of guys on the street, especially on the main street, Broad Street, hijacking people and breaking into people's cars. We are concerned about those kinds of situations because our people deserve to live and move in peace. We have witnessed on several occasions guys on the street as early as 7 in the morning and breaking into people's cars, opening it up and taking whatever they see, whatever valuable they see in your car. We are concerned about those kinds of things. We are also concerned about the black market on Kiri Street. We will continue to emphasize this. There is a black market on Kiri Street. I'm not sure that our authority have not seen the market. There are a group of people standing along the street on Kiri and Gurley Street. At the intersection of Kiri and Gurley Street, group of men are standing there every day from morning to night. They are standing there. The purpose of their standing there is to buy stolen valuables, cell phones, laptop, all of those kinds of things. They buy it right there. That's the black market. So they stand there, they send their agents in the field to go and bring those things to sell it to them. And how do they get it? They go and break into people's cars, break into people's homes and steal those things from them and bring it and sell it to them. And they in turn sell it to other people. That's the market. That market has been there from year in, year out. Do we care to follow up to know what those guys doing there? How are they, why are they gathering there all of the time? What purpose for which they are gathering there? Our security forces need to talk about it. Even though I spoke with Moses about it yesterday, and he told me that they were going to address those issues, but I didn't hear that in the press conference. And however, the Liberian National Police Authority of the Liberian National Police had a press conference yesterday, and they addressed issues regarding allegations of alleged ritualistic killings. And they said it was all of the death things that have been reported, there are none related to ritualistic killing, except one case of ritualistic killing that took place in Maryland County. The rest, they have not had any clue of ritualistic killing. We also heard the police authority that there are likelihood of people who are abandoning bodies on the streets, and unscrupulous individuals were involved in doing these kinds of things, posting false information on the social media to tarnish the image of the government of Liberia, according to the Liberian National Police. So, like I said, they dismissed, and they also dismissed almost all of the allegations about kidnapping. There were reports about kidnapping. People were being kidnapped. We heard about it on different radio stations in the media that people kidnapped victims, people who perceived to be victims were appearing on radio stations and they're trying to express their ordeals. But the LMP said there were no cases of ritual or kidnapping. So the cases that were reported, individuals are not responding. They are responding to the police, and they are providing, according to the LMP, information that they are not cooperating. So they've tried to rule that out. But they also show the public that the LMP and security forces are doing everything possible to ensure that the country is safe and the people can be able to move freely, and they should rest assured that the security of the country is intact. Nothing is going to destabilize the country. They are well on top of their games. So we'll also follow up with the issue involving Madam Keita, the coordinator of the project in the office of the president. We follow up on that matter. As you may be aware, Madam Keita was accused, it was reported in the media, thanks to Front Page Africa, that she was soliciting bribe from investors, and that issue was reported, and the president took action, and rather, he asked the legal advisor to investigate the special project coordinator over the LCC, even though the LCC has that responsibility. So we follow up since then. Since that, the forwarding of the matter, we've been trying to follow up. Yesterday, we got in touch with the Deputy Press Secretary Smith Tobit, and he told us that the legal advisor, Councillor Archibald Bernard, has been out of Liberia since the president, even before the president made the pronouncement. Councillor Bernard has been out of Liberia. So he returned a day or two ago, and Smith was not even sure whether the matter would have started in the absence of the legal advisor. So he was going to make follow-up, and we are going to make follow-up with Smith to know the status of that matter so that we can bring it to you. As far as our conversation with Smith was concerned yesterday, the investigation has not started. He was not sure whether the investigation has started. So we will follow up to know the status of that investigation. And we want to say thank you. Those were the issues we wanted to talk about. And because of time, we want to now take a break. As soon as we come back, we'll join our guests so that we can begin our discussion. Let's take a break. Thank you ever so much. Thanks for rejoining us. And if you are just joining us, the program right now is called Integrity Watch. It's a 1-hour radio program brought to you by the Center for Transparency and Accountability in Liberia. Like I said, we are hosting today the Executive Director of Public Health Initiative Liberia, Madam Joyce L. Kilikpo, and she is a public health practitioner. She has been working in the public health sector for over 6 years now. She's very experienced in the management of health programs at the national and international. So we are going to be talking about health accountability this morning. So, Madam Kilikpo, good morning. How are you doing this morning?
I'm doing fine, Sam. It's great being on this platform today.
Okay, good to have you, and welcome to the program. And why can you make yourself visible?
Come again?
Can you make yourself visible? The camera seems to be off from our end.
Oh, you want me to appear live? Oh my God.
Okay, let me go ahead. Okay, let's get to know how are you and your family doing today?
My family and myself, we are doing great. Yeah, we are very okay in health and all other things.
Great, great. Okay, Public Health Initiative Liberia. What do you do? What is it about?
Um, Public Health Initiative Liberia is a community-focused public health organization, non-for-profit, that is working to promote and enhance the quality of healthcare delivery in Liberia through leadership, partnership, innovation, advocacy, and that of capacity building. And we were established in 2011 and officially registered in August of 2013.
Okay. So established in 2011, and what are the different places of focus? Where do you focus your work? Are there thematic areas, health sectors that you are focused?
Yes, basically we have up to 5 key programs that directs our action or intervention. And one is integrated community-based health. We believe that health should be addressed in an integrated way. There are various things that determine health for all. So we look at health in a wholesome way, even outside of things that people may not look at, think that may not take as something that may impact health. So we look at other social determinants of health, family relationship, communities, the kind of homes that people live in communities. All of these things impact health. So instead of just going to give people medication or something, you have to take into consideration that environment, their relationship, and all these things as well. The food and everything they eat. So that is what the integrated community-based health look at.
Okay.
And then we also have water sanitation and hygiene promotion. That's one of our key areas of work where we work with communities, policymakers on improving water and sanitation within health facilities and also within community schools and public areas. We also do work on accountability in healthcare.
Mhm.
We believe that if we are going to have the desired health outcome for our population, for the public, we need to have accountability mechanism in place, policy that promote those things, and so forth. So, when it comes to accountability in healthcare, we work on at the community level and also at the policy level as well. At the
Great.
community level, where we empower communities to know their rights, to know their entitlement and their responsibility, future barriers as well, and bring them together to have an interface and be able to understand each other responsibility as it relates to accountability and how we can work to mitigate issue of lack of accountability within the health sector. And we also have our non-communicable disease program
Mhm.
that looks at particularly cancer, cervical and breast cancer. And in that, also at the policy level, and also pilot other interventions that are effective to be able to build donors and government buy-in into addressing reproductive health cancer, particularly in women that happens to be breast and cervical cancer. We also work with young people. We call that program the Joyce Initiative. It's an adolescent sexual and reproductive health program. As you may know, Liberia is one place where you have about 30% of our teenagers being pregnant before the age of 19. So we have a program that work with young people at the community level in schools and adult schools. On that program, we also champion the issue of menstrual health and hygiene management within school and also push for policy change as it relates to addressing menstrual health and hygiene issues. So basically, those are the programs that we do run as an institution. And yeah.
Great, great. Let's allow this to slip away. Congratulations. You replace Councillor Tiawan Gonglo on the Global Fund to fight AIDS, tuberculosis, malaria in Liberia. Congratulations on your preferment.
Thank you. Thank you. It's an honor. And we know it's a very big shoes.
Mhm.
And we look forward to working with all stakeholders within this health sector, particularly that are focused on addressing those 3 diseases, on how collectively we can work to ensure sustainable investment in the health sector and strengthening of the health system as well to address those diseases. So thank you.
Okay. All right. So let's go to the meat of our discussion today. How do you ensure what are the different thematic areas that you're working in, but want to specifically look at health accountability in the health sector? How do how does a program work to ensure that there are accountability in the health sector?
Thank you. So the health sector is one place that citizen gets to understand the level of services or intervention from their government and make them to understand their government own responsiveness to their needs, their basic social needs, which is one of the basic social needs is health and well-being. And under that, we initially, when we started, we didn't start immediately at the policy level. We started first of all working with communities through what we call health accountability committees. And through those health accountability committees, we were able to train community actors on understanding the services that government should be providing as it relates to health. What are the policy and what is their entitlement? And if this entitlement, they are having access to it or benefiting from this entitlement. Liberia as a country back then have a verbal policy because it's not really written somewhere but was pronounced by the then president that we have a free healthcare system. And with that free healthcare system, there were even facilities that had free healthcare, no money. You need not to pay money. There are other billboards all in those facilities. But interestingly, people were still paying money. So when we observed that, we saw that there was a need to have a conversation, to have data or engagement with community and know whether indeed they are paying money or not. And if they are not paying money, how is the system working? If they are paying money, why are they paying money? So first and foremost, like I said, we work with the Health Accountability Committee. And the Health Accountability Committees have what we call the essential package of health services. So with the introduction of the free healthcare services by the government, by the then government, they are set services that the government said they were going to provide at the various level of healthcare. So one of that level was the primary healthcare level, which is the very first level of healthcare at the community level. So we empower the community to know what was their entitlement as it relates to health services and what are those services that they can get from government when they go to the facilities. But interestingly, when we did that, we saw that most of the communities, the services were there, but the commodities that's supposed to make those services effective and efficient were not available. So in the health sector, there's a big thing we call, not much of a big thing, but it's a key challenge that almost everyone calls stock out. So today you have maybe paracetamol, tomorrow you come back and say, oh no, paracetamol, we are stuck out of paracetamol. So we, through our engagement, we got to understand that most of the facilities, they were stuck out, and this was affecting the free healthcare services pronouncement, as well as uptake of those services and demand thereof. Instead of people going to the health facility, they prefer going to the drug peddlers that are selling drugs in the bucket, or going to a drugstore and just buying drugs on their own and so forth. And they had a mindset also that the health workers were stealing the drugs and so forth. So with the Health Accountability Committee, we were able to build a relationship between the communities and that of the health service provider to allow the communities to understand why things are the way they are with the healthcare provider as it relates to service provision. So under that, we were able to establish that the free healthcare is now working, and there was a need for government to come up with a scheme that will ensure efficiency, acceptability, and that of accountability within the healthcare sector. So there where we still are and continue to work with government and see how we can address that. So apart from what we do at the community level, we have other advocacy engagement with that of the government addressing these critical things at the community level because primary healthcare is most cost effective, it's not expensive. If we cannot be able to address the healthcare needs for the people at the community level, we will need more specialized players. We'll have a population that is more sicker and not healthy, will impact the health, the workforce, the economy of our country, and so forth.
So you talk about the community complaining about this talk out. The communities complain. What did you, as an institution, establish? Were there corruption going on with the disappearance of paracetamol and other essential drugs in the different health centers? Did you establish that?
Yes, we established that in some of the health facilities. We also, for instance, there are some commodities that government is not providing, but other partners provide as well, like the malaria commodity, the HIV, the TB commodities. Those commodities, no matter what, they should not be sold to the patient or to the population in the public facility because why? Donors, partners are paying for it. But through that, we got to understand that some of the facilities, patients were paying for that. And also for the family planning commodity, there were facilities that instead of providing family planning commodities to young women and other women, they were selling it to them. Some were selling it for $1,000, for $10, and these things were established and some actions were taken by their immediate bosses as it relates to that. But one good thing was that the process built a kind of relationship between those participating facilities and communities. For one fact, they got to understand that most time the health workers will say we are stuck out or they will prescribe for them to find the drugs out is because the drugs the drugs that they have requested for that quarter is inadequate and cannot meet the needs of the total population that facility serve. Why? Because most of our drugs in this country is being paid for by donors, and the government is yet to close that gap that left out after the donors have paid for the certain quantity of drugs. So all of these things impact accountability at the health facility level. Two, we also got to understand that there's not really a mechanism within the facility to ensure accountability for some of these drugs. Some may just write a drug and say, okay, we have 30% that came for paracetamol. How can you verify that actually these 30% were giving the paracetamol and they are not names that are just used by healthcare workers, both name and the drugs taken back, is taken away by them for selling to the population, for instance. So what we were able to establish at the end put in place to address some of those things was community became part of the health facility development committee. They were more empowered to be able to be there when drugs come. They all do the counting of the drugs. They have an understanding as to how many population that drugs can serve and how long, though the drug is for a quarter, or how many months within that quarter the drug could go for.
Great. Thank you so much. Okay, so the Center for Transparency and Accountability in Liberia launched a research report on the state of corruption in Liberia. And in that report, 57% of the respondents, they think that the health sector is prone to corruption. And what do you think? You have been in the sector and been working in the sector and have tried to put in place different mechanisms for control. What do you think about the respondents' view?
I want to believe it's a fair view of the respondents for one fact of what we have seen and experienced within the sector as well, that indeed the health sector is one place that is prone to corruption, and there's a need to put in place mechanism to be able to address those things because the health sector is one sector also that is fairly decentralized. But being decentralized also has their own risks that comes with it. Whether those infrastructure put in place are strong enough to be able to prevent corruption or theft and other things as well. So, and I want to believe the population spoke to that because of their experience in the health sector. So, like I said, one thing that needs to be addressed is the issue of whether our healthcare system is a free healthcare system or is a fee for service. You cannot say you have a free healthcare system, but in reality, the people are paying money to access those services.
Okay.
Until now, the current leadership in place have not spoken to whether our healthcare system is free or not. So we have that in a health facility where people go, they have to pay money to be able to see a doctor or a nurse. They have to pay money to get medication and other smaller payments along the way that is not going within the government revenue, but is being pocketed by someone. So the people are using the services and they know for the well where the corruption starts from. And also, the health sector is one place that is prone to corruption when it comes to the issue of procurement as well.
Okay. All right. Do
So
you
you
agree?
have the issue of
Yeah, go ahead.
accountability, looking at I think 2 or 3 areas: financial accountability, performance
Yeah.
accountability as well. You have health workers that are assigned probably in Bokonchide, but they are living in Monrovia. So that's another
Okay.
form of corruption too within the healthcare system. You have a health facility that is overloaded with more than require health workers that's supposed to be, particularly in urban areas. That also is another form of corruption or accountability issues that needs to be addressed.
Okay. Do you also agree with these challenges, especially in the local area and the health facilities? The report also highlighted people who supposed to be in charge, who supposed to be coordinating and ensuring that these issues are addressed. They themselves are found in the web of corruption. For instance, the Senator of Montreal County, Senator Sir Joseph, he was the chair of the health committee at the Liberian Senate, and he awarded contract to himself for ambulance services. You have the former senator of Banku County, Senator Peter Coleman. He was also chairing the health committee. He awarded contract to his facility owned by him. And all of these things are highlighted. Those are people who are supposed to be the one who are in the driver's seat to address these kinds of things that you are talking about. Do you think these issues can be addressed with all of these kinds of surrounding from the top to the bottom?
Yeah, it can be addressed. We just need political will and commitment, not just to talk about it, but that action are actually put into place. And I believe that's why we have other governance institutions to be able to address that. We have PPCC. Where was PPCC when these contracts were awarded to these people? We have the internal audit. I mean, we have the Auditing Commission, right?
The GAC, yeah, the General Auditing Commission.
GAC, General Auditing Commission. So I want to believe there are audit reports that speak to this. Have there been action taken? And we have the LDCC, people who have been caught in corruption or alleged of being corrupt. Have they brought them to book? So until we can have this governance institution functioning effectively, we will continue to go in cycles. I heard about that, and I read about that on Front Page Africa with that of Senator Sir Joseph, and that, I mean, there's no reason for that. If, I mean, you can clearly see that there was an influence based on the position he held that led him to having access to those contracts. Was there competitive bidding? How many organizations or institutions bid for it? What was the capacity? How long has he provided such service? And who were his previous clientele? And all of these things, I know when you are procuring someone's service or an institutional service, those are things that you look at to see the track record on all of these things. So until the entire government, that is from the executive to the legislature and that of the judiciary, come together to effectively address corruption, we still want to be faced with these things. And the human impact of this action is terrible.
Okay. Okay. The human impact is terrible. What do you mean? Can you elaborate on that further?
People losing their life that had no business losing their lives.
Okay.
We have people being handicapped for lifetime that had no business because of the peculiar situation we face within our healthcare system.
Okay.
Because if this person is providing ambulance services and then he's not meeting up with the service demand, who's going to bring him to book? He should be able to provide oversight. If the ministry is not perfect, can he effectively provide such oversight?
So who watches the watchdog? That's the question there.
That's the thing. So, and the watchdog end up becoming the implementer. So who brings him to board? So that's why we see ourselves in the web as we are in. I always say to people, if we want to have the healthcare system working effectively, the health ministry has to be responsible just on the issue of policy, ensuring there are policy and regulation in place, and then outsource those services and monitor those services. But as it is, they implement, they put the policy in, they implement, they monitor themselves. So who's going to hold themselves accountable? So there's a need for an accountability mechanism to ensure that things are working the way it should. Otherwise, we still going to keep going in cycles as it is. We have no reason that we should have hundreds of women dying in childbirth. Childbirth is a natural phenomenon. But because of these challenges we have faced, the issue of accountability, the issue of poor leadership and governance affect the outcome of a pregnant woman, pregnancy, whether she's going to have a baby alive or whether she's going to come out alive. It's something that is in question mark.
Great. So you are listening to the program Interpreted Watch. It's a 1-hour radio program brought to you by the Center for Transparency and Accountability in Liberia. It is aired every Thursday on ECOWAS Radio 91.5 FM. It's relayed on Prime FM in Monrovia. So the program runs from 11 to 12 noon and is a primary radio-based communication and information dissemination platform of Central. So today we have as our guest the Executive Director of Public Health Initiative Liberia, and she's very occurrent and very experienced in the health sector. and she is Madam Joyce L. Kilikpo. She is our guest, and she's on the line. So we want to have this program to be participatory. So we want your view on our discussion. So we want to open the lines now whilst our guest is the line and listening to have your participation. So let's open the line. The number to call to be live on this program 0779 0691. The number is 0779 0000691. 0779 That's the number to call to be live in the program in 30 watch, and we are talking about health accountability. Madam Kilikpo has outlined some of the issues, the challenges, and she talked about, like the report said, the report released by Central said, political will. One of the key issues that all of the people who came and attended the program, the people who validated it, they've talked about that over and again, the political will. So the numbers to call. Alternatively, we can also call the number, the Lumos number, 0886-474-5663. So you can be live on the program. The orange number, we have our first caller on the line. Good morning. Your name and where are you calling from? Or let's hear you. Mhm. Mhm. Yes. Okay. Thank you. Thank you, Lord. Thank you ever so much. So, Madam Kilikpo, Lord is asking the question. He's asking about accountability and monitoring and evaluation. Do you have mechanism in place for monitoring evaluation and to check the different equipment that are being used in the facilities and the professional people who are providing these services? People who are providing these services, are they professionals? And he talked about the issue fake drugs on the market. Those are issues that were highlighted in the report by Central. Can you speak to that?
Again, as an institution, we do not have certain capacity to do some of those things, but we know further well that there are challenges on the issue of monitoring and evaluation as well, where particularly that challenge is relates with the issue of taking action on monitoring or evaluation reports that are submitted to leadership within the health sector. So, for instance, in the health sector, I will give one scenario about maternal death, women that die in childbirth. So, the ministry has set up a mechanism along with partners on identifying the cause of every death should be accounted for every woman that died in childbirth or child that dies during childbirth process should be accounted for that death should be properly accounted for. So there's what we call maternal death audit. So if a death occur in this facility, that facility will be audited as to why that death occurred. And most time, the information there shows that either is negligence on the part of the health service provider, the staff were not properly trained, they never had the right equipment or tools to work with, or what should I say? The staff, they didn't know when to make what decision. They didn't take decision on time to save the life of that mother and her baby. And this is where the challenge lies. Ministry comes up with these reports. They either give it to the Liberia Medical and Dental Council to take action. And you also have the Liberia Board for Nursing, also nursing and midwifery and nursing to take action. And they find that the Ministry of Health does not have that authority to close down a facility or opening of a facility. It is left with another agency, regulatory agency that have to do that. And all these human relations things and so forth. Just play into it, and most time you don't really get redress on that. So I would just want, but pertaining to the part that speak to monitoring equipment or staff and all of these things, and what are put in place to be able to mitigate some of the challenges around those processes. So there's a lot of work to be done, much when it comes to governance and leadership within the entire health sector, not just of the Ministry of Health, but with the other regulatory body within the health sector. The issue of fake drugs on the market and so forth, the Ministry of Health is not clocked with the authority to seize drug or other things. So it's the Liberia Medical and Regulatory Health Authority, the LMHR, something I've forgotten the acronym so well, but they are responsible. And we tell God, thank you that of recent, in the last 2 years, they are starting to be more active and more visible. If you look around town, you see there are some billboards on people calling and reporting fake drugs and so forth. But it's just in Monrovia, I have seen that there's a need for it to get outside of Monrovia, and there's a need to ensure that if we are stopping the people from buying these drugs from drug peddlers, that they also have an alternative to access quality drugs. How do they know that this drug is quality or not? There should be mechanism in place to be able to say, okay, when you see this sticker on this particular drug, knows that it has been approved by us, it has gone through all testing, and is not a fake drug. Until that can be done, we're still going to be faced with those challenges.
Great. Okay, Kilikpo, let me ask you this question. You work in the health sector. What role did you play in the COVID-19 response?
Thank you. Interestingly, COVID-19 has not been like Ebola response.
Okay.
For one fact that the COVID-19 response is heavily led by government. It's more or less a very close space that has not really ensure inclusiveness. That is to ensure a due or collective response that brings on civil society and other actors. However, as an institution, the fact that it's an health emergency and we are a public health organization, we have been engaged on raising awareness, linking people to services, as well as answering their questions as it relates to fear they have to COVID-19 or the vaccine. Another aspect we have been engaged with is to ensure that government maintain the same level of services for women, children, and girls prior to COVID-19. So we, as an institution, is a core convener of a platform called the Liberia Health Civil Society Network. And through that civil society network, we have been able to conduct assessment and survey as it relates to access to essential reproductive health services during COVID-19. And with that assessment, we're able to pull series of health facilities as it relates to access and availability of services and commodities. And interestingly, Maserado, where COVID-19 is the highest hit on COVID-19, have been the one also not providing those services, not continuing those services in the face of COVID-19. So those are things we have been working on, and our work has been mainly on the area of advocacy and pushing for accountability. So apart from that aspect, we also monitor the World Bank COVID-19 Emergency Response Project, particularly as it relates to stakeholder engagement and addressing grievances and other things. So with that, we work with the Ministry of Health and the project implementation unit of the World Bank on ensuring that stakeholders are engaged according to the World Bank instruments for financing various governments, whether it is in emergency or not. And interestingly, we were able to establish that there was not sufficient stakeholder engagement or broad stakeholder engagement as it relates to the emergency COVID-19 response project. And we recommended to World Bank to ensure that subsequent projects takes that into consideration. Emergency or outbreak should not be used as an excuse for not engaging stakeholders on what they are going to deliver and what is the stakeholders' expectation from them as it relates to COVID-19 and where, and also to ensure that stakeholders understood where this money was going to spend and on what and how long. So all of these things, we have been working with them on that to see how we can ensure that what was in the project document by World Bank and the government is actually being implemented.
Great. Did you follow the report on COVID-19 response?
Yes, I followed the report.
Okay, just a minute. We got a caller on the line. Let's take the call. Good morning. Your name and where are you calling from? Okay, Mr. Taylor, let's hear you. Mhm. Mm. His facility, yeah, yeah. Mhm. Yeah. Mhm. Okay, all right. Thank you. Thank you. Thank you. Let's do that because we are very running out of time. Okay, our guest is member of the civil society. She works within the health sector. Okay, let me allow her to talk about. He's asking about what mechanism are there in place to be able to address issues about corruption in the health sector.
Thank you. We are from civil society. We are not the one leading the health sector. However, We amplify voices of people like his questions that is being raised. We help to amplify it on decision-making tables. We ensure that government and other actors come together to collectively address those challenges that are facing our sector. So as it stands, there's not a clear mechanism put in place to address corruption. And yeah, like that, as I would say. Apart from where you have in some of the facilities, they say no money business, but still money business is happening there.
Even more than that. Okay,
Yeah.
let me ask you this last question. Who will be your party comment? Have you all in the health sector identified QPW? Who is QPW?
I don't know who Kiwi is. And I saw that document. Until now, I don't know whether it's Kwekwe Piwi or Piwi. I do know. I do not know, and I don't know even of Kwekwe Piwi. So, yes, that shows to you the challenges that the health sector is faced with when it comes to accountability. And if we are going to actually ensure efficient and effective health services, the government have to come up with a financing mechanism for our health sector that is also able to address the issue of corruption at the community level and also within these facilities. So, for instance, if we introduce, how should I call it, an insurance scheme, you have to do something that will try to reduce payment, physical access to cash within the sector. You have to put in place mechanisms that will reduce physical access to cash, whether people will have to pay for health services through a token. You have to pay that token for your family for a year and other things in place. I know.
Okay, we'll have to rearrange our appearance so that we can further elaborate on the different issues that surrounding the health sector. Time has caught up with us, so we'll leave it just at that. She has been our guest, Madam Joyce L. Kilikpo has been our guest. She is the Executive Director of the Public Health Initiative Liberia. The program we've been listening to is called Integrity Watch, a 1 hour radio program of Central. My name is Sam Zota. I'm the Media and Communications Officer at Central. My colleagues Mark Buandao and Geraldine T. Wendy depend on the camera, making sure our visibility goes beyond studio. Join us next Thursday for the edition. Goodbye.